Hey guys, this is Dr. Shannon Clark with Babies After 35. I am waiting for my guest to join, so hang tight. Please, if anybody, I am at a beach house and so my reception has been a little shoddy, so please, anyone, if there's a trouble with you guys hearing me at any point, I watch the comments as they come up, so please just let me know if there's any problems with reception or, oh, there's Corbett, okay, hold on. If there's any problems with reception or anything, please let me know. Here we are. Waiting for her to join. Hello.
Hi.
And this is my guest for the day. I am super excited to have you. I'm going to do an introduction first. So this is Michelle McDougall, and I wrote everything down on my laptop, so bear with me. She is a genetic counselor who trained at UT Health Science Center in Houston, Texas, which is where I live. Are you still in Houston as well?
I'm not. I'm in California now.
You're in California? Okay. She has experience working in a clinical setting, seeing both prenatal, which means either before pregnancy or during pregnancy or antenatally, and cancer genetic counseling patients. She joined Cord Blood Registry, which is the account that she's joining us from today. And she joined Cord Blood Registry in 2017 and educates healthcare providers and families about the potential of newborn stem cells. So, and I'm Shannon Clark. Sorry, guys. So the reason why I wanted to do this session is first, I used Cord Blood Registry for my twins to bank their cord blood. Number two, this is Cord Blood Awareness Month. And number three, I still think that despite there's a lot of information available on banking your baby's cord blood, but people still don't know a lot about it. So when I was advertising about this, a lot of people were like, oh, I haven't heard of this. Let's talk about it, or I'm going to join. So again, thank you so much for joining me today so we can have this discussion.
Yeah, I'm really happy to be here.
Okay, so let's just get into this. Okay, first of all, what is cord blood?
Yeah, so cord blood is actually just the blood that's left over in the umbilical cord and in the placenta after the baby is born. So baby comes out, cord is clamped and cut, and then whatever blood is left over is what we would collect and store at CBR.
Yes, so what is it that's special about cord blood? What is it about cord blood that is worth banking?
Yeah, so cord blood actually contains lots of different types of cells that we think are going to be valuable in various types of medical treatments. But one of the most important types of cells that's present in cord blood is a type of stem cell called a hematopoietic stem cell, or an HSC. And these particular stem cells are stem cells that are able to turn into all of the cells that make up your blood and your immune system. So these are the types of cells that are used in stem cell transplants or bone marrow transplants.
Right, and also women may know about cord blood as well, and we'll talk a little bit about this, about delayed cord clamping for cord blood purposes. And also, if you deliver at an academic institution such as where I work, we do a lot of research, and a lot of our research involves cord blood samples. So we may ask you, hey, after they get whatever they need, can we have whatever is left over? And we use that for studies. You can study what kind of drugs, I don't mean illicit drugs. I mean, any kind of medication a woman's taking, we can sample the cord blood to see if there's medication there in that cord blood so we can know whether or not it goes through the placenta and the baby's being exposed. So there's multiple reasons why cord blood is helpful, especially for research and then for cord blood banking. But it's really cool. And you can actually, when we deliver a baby, every baby has a different type of cord. Every baby has a different length of cord, how thick it is, and sometimes babies have more cord blood in the cord that's left over, and sometimes they don't. It also depends on what type of delivery, the circumstances of the delivery, how much cord blood's available. I know that a lot of centers will take a sample if the mom has a certain blood type because they need that to help with the baby when it's born as well. And then what's the other reason? We also take some cord blood, or we get a sample if we do cord blood gases. Okay, some centers routinely do cord blood gases. I'm at a center who does that. And that's just where we get a sample from one of the arteries in the cord, because there's 3 vessels, and one of the veins in the cord. And so sometimes that's important for us to get those samples as well. So there's multiple uses and multiple reasons why cord blood is important. So you mentioned talked about the HSC cells. So specifically about the HSC cells, what makes them particularly special or unique?
Yeah, so I think one of the great things about collecting these cells, so these cells are actually present in different sources in the body. We can get them from cord blood, we can get them from peripheral blood. If you take medication to make the bone marrow release it into the bloodstream. And then, of course, we can get them from bone marrow. So there are multiple sources that we can get these particular cells from. But one of the reasons that we like to get it from cord blood is because it's just really easy and really safe to collect. A bone marrow harvest and even collecting those stem cells through peripheral blood is going to involve at least some time at a hospital, you know, a little more of an involved process. And they're just really easy and really safe and completely painless for mom and baby to do this collection. So it's just a nice, easy way to collect these cells. And then the nice thing about it is we freeze them. And then when they're needed for a medical treatment, they're ready to go. We don't have to search for a donor or figure out how to get them or wait for them to be collected. They're already, you know, there and ready for us when the treatment is needed.
So another thing I wanted to mention, and you could probably elaborate on this. So an example I have is like a skin cell. If I take a skin cell, that can only make another skin cell. If I take, I don't know, what other kind of cell, in a blood cell, a red blood cell, it only makes other red blood cells, or, you know, maybe I'm reaching here. But with the HSC cells or the hematopoietic stem cells, they can mature or turn into various types of cells, right?
They can. Okay. So they are limited to blood and immune system cells. Okay. They can't become any type of cell in the body, but they can become any type of blood or immune system cell. So they can become like red blood cells, white blood cells, platelets, anything that's in your blood or your immune system, these cells have the potential to become.
And that's also very important for some of the blood cancers as well, correct?
Absolutely, yeah.
Yeah, which is one of the more common reasons I think that people might do that, but we'll talk about that as well. Okay. So while we're at it, and we already mentioned on this, what is it, how can the HSC cells be used to treat diseases? Like what kind of diseases can they treat? I know there's a lot that they could treat, and then how are they used to treat these diseases?
Yeah, so when I talk about how cord blood is being used for diseases, there are kind of two categories of treatments that we talk about. So there are the approved treatments, which are all around stem cell transplants. So there are kind of four categories of diseases that can be treated with stem cell transplants. There are some types of cancers, which you mentioned, leukemia and lymphoma are definitely the two most common, but there are a handful of other types of cancers that might use stem cell transplant as well. There are a group of metabolic diseases, which are like rare inherited diseases in families. And then there are several types of blood and immune system diseases. Totally makes sense, right? These are the cells that can turn into blood and immune system cells. So it makes sense that those kind of conditions would be treated. So those are going to be things like sickle cell disease, beta thalassemia, different severe forms of anemias. And then like immune diseases like severe combined immunodeficiency diseases, where we can sort of use these cells to reset the immune system. So that's kind of the main category, and there are actually over 80 different diseases in total that can be treated with stem cell transplants, and all of those are already FDA approved and well established and have been done, you know, for over 30 years. So that's kind of the main category that I think people are aware of. And then there's this newer category of diseases that are still investigational. So these are not approved yet, but we talk about them a lot and we get excited about them a lot because there's a lot of active research right now looking at the stem cells from both the cord blood and the cord tissue, which we haven't talked about yet. But both of these types of cells that are potentially going to be used in many, many new different medical treatments for lots of more common conditions, which I think is what people like to learn about because these are conditions like cerebral palsy, autism, diabetes, osteoarthritis, just lots of really common conditions. So I think that's, you know, that's interesting. And I think we can probably dive into that a little bit more later on. But the whole idea there is that, you know, those diseases are just much, much more common, but it is important to distinguish that all of that is still in the research phase right now.
Yeah, so basically, you know, I know a lot of the research centers you hear about that specialize in cancers and other types of things, or any kind of neurologic immune system disorders or any other genetic type disorders. You know, they want to research stem cells and what their capabilities are. So I know in some, you know, I'm not a cancer doctor, but I know sometimes when other therapies have failed, they may enroll you or ask someone to be in, if you're interested in being in a new study that might involve stem cells. So of course that's experimental, as Michelle said. You know, there's a lot being done with stem cells. So I think that it's a wide open space that's being investigated, which I think is really, really cool. And I think, do you think all that can come from an umbilical cord? I mean, yes, you can get it from different areas as an adult, like in bone marrow samples and that, but you know, babies are pretty cool. That's just one of the reasons why.
Yeah.
Okay.
Yeah, I actually think the stem cells from the cord blood and the cord tissue, I mean, there's lots of evidence to show that they're even more highly functional than, you know, the cells from those adult sources because you've been carrying around your bone marrow your whole life. So anything you're ever exposed to, those cells are exposed to. So
yeah, so that makes sense. Okay, so what would be some of the advantages of using cord blood to treat certain diseases? Do we know some of this specifically about if there's anything specifically that's advantageous of using cord blood to treat these diseases?
There are, yeah. So I mentioned one already, which is just like the ease of collection.
Yeah.
And then they're also readily available when it's time to do the treatment. We don't have to try to harvest them at the time of treatment. But I think one of the biggest advantages is just that because these cells in cord blood are so new and fresh and they're not, you know, fully developed their kind of immune properties or immune system properties, let me back up for a second. When we're doing stem cell transplants, it's kind of like organ transplants in that you have to find a genetic match. So like if you need an organ, you got to find a matched organ. Same thing is true for cord blood in a transplant. You need a matched cord blood unit or a matched bone marrow donor to be able to have a transplant. But cord blood allows us a little more flexibility in that matching. So it doesn't require as close of matching as using bone marrow would require. So that means that more people can have access to that treatment because it can be really tough to find a perfect match for a stem cell transplant.
Right. So, you know, just to summarize, so some of the advantages of using cord blood rather than for stem cells, rather than like a bone marrow transplant, is some of the things that Michelle already touched on, but we'll summarize. So it can be given to stem cells from the cord blood can be given to more people than those from bone marrow. And that's because, like she said, there are more new cells. And so the rejection rate is lower for these diseases. We already talked about the ease of collection. It's a lot easier and it's painless to get a cord blood sample than it is to do a bone marrow transplant. It can also be frozen and stored, whereas if you do a bone marrow sample, that has to be used rather quickly, right?
Correct. They usually won't collect that until it's, you know, time to do the transplant.
And then also stem cells, and I didn't know this until I was doing my research for this talk, is that stem cells and cord blood can be used to strengthen the immune system during cancer treatments, whereas bone marrow stem cells cannot. I didn't realize that.
Yeah, so sometimes they can be given like even in combination with other sources to help and boost that immune system.
Yeah, I had a cousin who had a blood cancer, and that was one of the treatments that he was given. So yeah, I knew a little bit about it, but not quite enough. Okay, are there any disadvantages to using cord blood to treat certain diseases?
So I think maybe the one disadvantage that comes to mind is that when we are collecting cord blood, it is a finite resource of cells, right? We can only collect however much cord blood is in that particular placenta or that particular cord. So we're working with a finite resource of cells. So that does mean that in some cases, we wouldn't have a large enough sample to be able to use for an adult. We might need 2 cord blood units to treat an adult. Or, you know, for various reasons, we just wouldn't have the correct sample size. It's a little bit easier to get those larger samples from bone marrow or peripheral blood, but that's really the kind of disadvantage.
Right. Okay. So then also, I want to also touch on the difference between having an autologous transplant versus an allogenic transplant. I know those are 2 big words, but let's first start with autologous transplant.
Yeah. So an autologous transplant is when you are using your own cells for treatment. And there are some situations, some diseases that can be treated where we would want to use a person's own cells for their treatment. And I think in a transplant situation, this is maybe a little more rare than the other type that we'll talk about in a second. Because a lot of times we do want to use a healthy donor stem cells, just like we would want to use a healthy donor's organ, right, for a transplant. But there are definitely some diseases where we always want to use a person's own stem cells to treat it. And that's what an autologous plant is.
So the disadvantages of the autologous, though, is that if I got cord blood on my twins, but if say one of my twins had a genetic disease, those stem cells cannot be used to treat her or his genetic disease, because those cells are likely had the genetic disease as well, right? And
correct.
The same thing would be for leukemia. So if one of my twins had leukemia, their own stem cells couldn't be used to treat that leukemia because it's already there. Yeah.
It's just because it's a childhood leukemia. It's actually several types of adult onset leukemias. We do use a patient's own cells for treatment, but specifically childhood leukemias.
Yeah.
And that's also because we think there's likely a genetic component, even if we can't identify it. And that's really why. So it all does come back to, if we think there's a genetic, cause for whatever the disease is, we can't use the person's own stem cells because, like you said, they have the same mutation or the same change that's causing that genetic condition. So it's not going to help to use those cells. We want to use someone else's.
So let me ask you this. Since I have twins, they're boy, girl, and say one twin develops something that could benefit from stem cells, and could the other twin's stem cells potentially be used?
Yeah, potentially.
And the same thing for kids in the same family as well. Like if you were banking cord blood from, each one of your children, they could potentially be used to help the other child. If they
exactly.
Right. Okay.
Exactly. So we actually do recommend that people bank for each of their children because there's not a 100% chance that the children are going to be a close match. But there's, up to a 75% chance that they would be a close enough, each sibling would be a close enough match to use the other sibling. So the more you store, the more likely you are to have a suitable match for every child.
Right. Okay. So let's talk about allogenic transplant.
Yep. So this is like using a sibling's cord blood. This is when you're going to use somebody else's cord blood or somebody else's bone marrow for a transplant treatment. So it can be a related donor like your sibling, or you can use your child's cord blood potentially for a treatment, or it can be a completely unrelated donor, which is like the situation where if you donate your cord blood to a public bank so that someone out there in the world who needs a transplant could use it. So an allogeneic can be either related or unrelated, but it just means that it's a non-self donor.
But typically when you have an adult that needs a stem cell transplant, they're going to get stem cells from multiple people, right? Because one sample from one person may not be enough. Is that true? Or more
for cord blood? Yes.
Okay.
Yes.
Cord blood,
Yeah, so it depends because cord blood, like lots of medications, is dosed by weight. So it really depends on the size of the person being treated and just the size of that particular cord blood unit. Sometimes one is enough for an adult, but it really is just going to vary sample to sample and situation to situation.
Cool. Okay. So what you already touched on that. The difference between public blood banks and private cord blood banks. What's the difference?
So for public cord blood banks, I really encourage people to think about this as like you're giving up that cord blood unit for the greater good. So you're giving up your rights to it. You don't own it. The whole purpose of it is that so someone out there who didn't bank their own cord blood or doesn't have another source of cells or can't find a close enough match with bone marrow would be able to use that cord blood sample for a transplant. There's no cost associated with donating to a public bank, so I think it is a very attractive option for lots of people, just to be able to make sure that cord blood goes to like some good greater use, right? Mm-hmm. And then private banking is a little bit different. So the idea with private banking, which is the service that CBR offers, is that you are storing the cord blood and the cord tissue, if you choose, exclusively for your own family's use. So you own these cells and we're essentially keeping them safe for you until they're needed for a treatment.
Yeah, so basically we could touch on this. Basically, the way it works is you sign up, and one thing that I really loved about CBR, and yes, I use them, and trust me, I researched all the possibilities of where I could do private cord blood banking, okay? I'm like that. I thought it was very easy because there was always somebody that was, and I still have their emails, that's how I got to you, where I can email, call, they helped me every step of the way. I was actually on bed rest when I was going through this, and they pretty much did all the work for me. And they educated as well. So this is not something that you necessarily have to just go online and figure it out yourself. There's an 800 number there. You could be assigned your own person that's going to help you walk you through this process, which is what they did for me. They sent me the kits. I think there was a fee for sending the kits. Then you get it collected, the cord blood collected, and then you send it back. They give you the packaging to send the cord blood specimen back. Then they analyze the specimen to see if it's good enough to store. There might be some situations where not enough blood was obtained. I know one of my twins had a really good sample, and one of my twins did not have, and we could talk about why that happened in a little bit, but one didn't have a great sample, but it wasn't bad enough to just disregard. Then based on whether or not you get enough to to bank, then there's the additional fee. So it's not like you pay for everything up front and then it's like an all or nothing. You pay the X amount of dollars and then you don't have anything to bank. It's based on what if they're able to do that, right?
Yeah, so we actually don't charge anything at all until we receive the sample at the laboratory. So there's not any upfront costs associated. You enroll, we get a credit card on file, and then once we receive the sample, that's when you'd be billed. And yes, there is, definitely the opportunity. We have a team of genetic counselors who goes over those quality results that you're talking about.
The quality results, yes.
With, each patient, if it doesn't meet threshold, or our kind of metrics that we set. And yes, so there's definitely the opportunity to talk about quality of the sample, if it makes sense to continue storing it, how it might limit the use of it in the future, all of that stuff.
And there's different ways to pay. You could pay up front, you could do monthly payments. There's all different options for payment too. Because it can be intimidating looking at how much it really costs, but they work with you because they want you to have that option. So, which I think is great. So, CVR has been awesome about that. So I do appreciate you guys. Okay. And then obviously Michelle mentioned that CVR, which is Cord Blood Registry, is a private bank, which is different than the public banks that we spoke of. And whatever you do through CVR is your cells, it's your property, and they just store it and maintain it for you. So moving on. So what steps need to be done before cord blood is collected? We already just talked about that, but let's start from the top. I decide that I want to do this. What happens from there?
Yeah, so you can actually sign up with us either on our website, which is cordblood.com, or you can call the 800 number, which is just 888-CORD-BLOOD. And if you call the number, you would get connected with what we call our newborn stem cell educator. So this is the people that you're talking about. They can provide education, answer all your questions, get you signed up, make sure to talk through the payment plans with you. And then once you get all enrolled and have decided you want to move forward, we ship a kit directly to your house. When you receive that CVR kit, you can open it up. There's some instruction booklets inside that tell you kind of your checklist, what you need to do. But then you can just kind of put the kit with your kind of hospital bag, or, get it ready to take it with you to the hospital. You take it with you to the hospital. Make sure you remind everybody when you get there that you're going to collect cord blood and/or cord tissue. And then once the collection's done, baby's born, collection's done, you're kind of back in the room, resting and kind of getting settled. That's a good time for your partner or your support person or whoever's there to call the courier. So there's a medical courier who comes directly to the hospital to pick up the kit. You're not responsible for kind of shipping it off. So we try to make it as easy as possible.
So I'm going to throw in some tips here as a maternal fetal medicine specialist delivering babies. So we recommend, you guys recommend at least 6 weeks if you can before your anticipated due date, to ask for that kit, because you never know what might happen. You might go into preterm labor or have preterm delivery, which is what happened to me. I delivered at 31 weeks, and I think I had just gotten the kits maybe a week or two before. But I was on bed rest in the hospital. I didn't have anything else to do. So I did it kind of early. So do it sooner than later. It's not going to hurt to do it earlier, to just have that kit on hand. Let your provider know this is something you want done. I know there are some areas, every hospital is different. Every female is different. Family is different as to whether or not they want to bank their baby's cord blood. So some providers might have more experience with it than others. So if yours does have experience, that's great. But if not, they need to know. The time to let them know is not when you're going in labor and say, oh, by the way, here's this kit. And they're like, what? And because it can seem intimidating, it's really not. It's actually very easy. But if they're worried about you delivering and coming in, and the last thing they want to worry about is learning how to do cord blood, get your baby's cord blood. Not that they won't do it, but if you give them time to prepare, the better chance you have of getting a better sample, which is very, very important. So let them know as soon as you decide, if you're wanting to bank your baby's cord blood, that you have this kit. As soon as you go to the hospital, let your nursing staff know. Let whichever nurse knows that is assigned to you that day, let her know that you have this, so it's not forgotten. Even in an urgent situation, we can still make an effort to collect that cord blood. Okay. I've done it before. It may not be easy depending on the circumstances of the delivery. If it was an urgent delivery for whatever reason, but we can still make an effort to get as much as we can. Okay. So it doesn't have to be thrown out the window just because your labor didn't go as planned. If you prepare everybody and everybody is prepared to do this, then we can still try to make it happen. So has that been your experience as well? As preparation and education as early as possible is key?
Definitely, yes.
Yeah.
And we do put an instruction booklet with pictures in every single kit. So if your doctor has never done one before, I think, you know, there's still plenty of time to make sure they see that instruction booklet ahead of time. As soon as you get your kit, you can show that to them. So it is very easy. But like you said, a last minute kind of warning can be a little bit shocking. So
it's happened to me, but I've done it enough times that I'm okay with it. But there's been times where I had no idea until baby's almost here. And oh, by the way, doc, I'm like, well, what? Wait a minute. So, you know, luckily I know how to do it, but I can imagine if it was a doc that wasn't used to it, they'd be like, how am I supposed to figure this out? Right? Because once the kid's born, you don't have an infinite amount of time to do this. You want to do it sooner than later. So it's better to be prepared. Okay. We'll talk about a little bit, go through the process of how it's collected.
Yeah. So it's like we've said, it's very, very simple. So baby comes out. Once the umbilical cord is clamped and then it's cut, so baby's separated from the placenta, that's when we would use the cord blood collection bag. So basically there's just a needle that is attached with tubing to a collection bag. That needle is inserted into the umbilical cord, and the blood flow, just kind of gravity and the placenta helps push out some of the blood, and it just flows into the collection bag. Once that flow stops and we can't get any more blood out of it, pull the needle out, the cord blood collection is done. And then if you are collecting cord tissue as well, your provider would just cut about a 4 to 8 inch segment of that umbilical cord tissue. And then there's a little cup inside the kit that the tissue goes in. So very simple.
And there is some paperwork that needs to be filled out too, like delivery information, if I remember correctly as well.
Yes. So ahead of time, there's like a maternal health history form where we kind of ask questions about mom and her health. But inside each kit, there's also a little data collection sheet. There's not much to fill out on there. So a little bit of information from the family, and then more of that information is really from the provider about the delivery. So typically the provider or the nurses would fill most of that out. You know, parents will do a lot of their paperwork ahead of time.
Yeah. Okay. Okay, let's see. What else should I think about deciding whether today? We already talked about that. So let's talk about, we touched on that, but let's go back over it one more time. If I have twins, I have stem cells from each. I have a better quality sample for my son than my daughter. And I think that's probably because she was, at 31 weeks, she was 3 pounds, 4 ounces. He was 5 pounds. So her cord was like this compared to his. He was just a bigger kid with a bigger umbilical cord. And that's probably why. So who could potentially use their stem cells?
Yeah, this is probably the most common question that we get asked. And I think there's actually a lot of misinformation about this. I think sometimes people hear that only the baby can use their own cord blood. Sometimes people hear that the baby can't use their own cord blood. So there's a lot of information in different directions. In general, when I think about cord blood, I typically think about the immediate family potentially being able to use it. And it kind of goes back to that genetic matching that we were talking about earlier. The more closely related you are to a person, the more likely you are to be a genetic match to them. And that's why I think of the immediate family. So in some situations, baby would be able to use their own cord blood for a treatment. Whether it's for transplant or, you know, most of those experimental therapies that we haven't really talked too much about, those are actually mostly using the child's own cord blood. So there is definitely potential baby would use their own cord blood for a treatment. We could also, the most likely scenario actually is that a sibling would use it for a transplant. And we talked about there being a 75% chance that siblings are going to be a close enough match to be able to use that unit. And then there's also a chance that the parents would be able to use it. So parents are always going to be a half match to the sample or a partial match. And that's all that's required for using cord blood. That's because of that flexibility we talked about a little bit earlier. So parents are always going to be a close enough match. The question about whether parents can use it is going to come down to how much we collected and if there's enough there to treat an adult.
And so while we're talking about this, and I'll just share my own personal experiences. It's not a secret, but I had my twins were conceived via donor egg. So that was another reason, and I'm sure this is becoming more popular too in women or in families who are using third-party reproduction or using other ways to become pregnant, where there's a sperm donor or an egg donor, because I knew by using an egg donor that my possibility of potentially being a match for them, as Michelle said, a parent should have up to a 50% chance of being a match. That was kind of taken out of the equation. Not 100% taken it out, but probably taken out. So that left my husband. So I wanted to go ahead and bank their cord blood because I wanted to at least have more of an option for them. Do you find that that is becoming more of a common reason that people are doing cord blood banking?
Definitely. I think that's a great point to bring up. And I think that it's kind of a similar situation for people who are, you know, like you said, using third-party reproduction or even like mixed ethnicity, just because it becomes more difficult to find a match if we go to the public system. Whereas if you store within your own family, not only do you have a perfect genetic match, you know, if there's a third-party egg or sperm being used, you have a perfect genetic match to that child. But if you store from multiple biological siblings, again, that's just really increasing your chances to have a matched unit way above, in some cases, what you'd be able to find in the public system.
Good, good. So yeah, that was not the only reason, but that was a pretty important reason why we chose to do this. Okay, so we're going to talk about I'm sure you get this question a lot. Do I have to choose between delayed cord clamping and banking cord blood? But I'm going to stop for a second. I'm going to talk about delayed cord clamping. And I get this question a lot, and I think I am not against delayed cord clamping at all. And I'm going to go over pretty much verbatim what the Society for Maternal Fetal Medicine and ACOG kind of have summarized regarding delayed cord clamping. But I think women need to be informed about this and understand that it's not good in all situations, and I'll explain why. So let's talk about it. Delayed umbilical cord clamping means waiting longer after a baby is delivered to clamp the cord. Immediate clamping is typically performed within 15 seconds of delivery, whereas delayed clamping is performed 25 seconds to 5 minutes after delivery. Delayed clamping allows blood to continue to flow to the infant, thereby increasing the infant's total blood volume. Okay, so we're actually kind of transfusing the baby its own blood or giving it more of its own blood. So let's talk about the risk and benefits in a preterm infant. And preterm means less than 37 weeks, okay? Babies born between 24 weeks and 37 weeks are more likely to have difficulty staying warm, require immediate care by a pediatrician, more likely to have low blood pressure, and require a blood transfusion the baby's born at full term or greater than 37 weeks. So delayed umbilical cord clamping may reduce a preterm baby's need for blood transfusions and the risk of bleeding in the brain and of serious bowel complications called necrotizing fasciitis. Now, those are not typically seen in babies born between 34 and 37 weeks. That's actually more seen in babies born at less than 32 weeks and not even as much between 32 and 34. So those are actually the very preterm or extremely preterm babies that are at increased risk for that, okay? It may also help increase the preterm baby's blood pressure. However, delayed umbilical cord clamping is also associated with jaundice, which is yellowing of the skin. You guys have had babies under the Billy light. That's jaundice after it's delivered. The immediate benefits of delayed umbilical cord clamping in preterm infants have been documented, but the long-term effects are largely unknown. So every hospital is a little bit different, and the obstetrics unit will have a policy along with the pediatrics and the neonatologists, the pediatricians and the neonatologists on what they do. You know, we don't routinely do delayed umbilical cord clamping on everybody. We will do it on babies born at less than 34 weeks. Depending on the nature of the delivery, if we have the time to do it, we will do it. If we don't, we do something that's called milking the cord, where we milk the blood. And there is a difference. There's not as much data on milking an umbilical cord to a baby as there is on delayed cord clamping. But sometimes if I'm delivering a 28-weeker or 30-weeker, I don't have 5 minutes to allow for delayed cord clamping. I need to get the baby to the pediatricians. So that's something that we have to decide as the delivery physicians, how much time we have. Okay, and so sometimes a compromise is for me to kind of push the blood from the placenta through the umbilical cord into the baby and then hand it off as quickly as possible. Okay, so if it's delayed cord clamping is something you're interested in, especially if your baby's under 37 weeks, make sure you talk to your delivering physician as to what they can or cannot do. Okay, so let's talk about the risk and benefits in a term infant. Compared to preterm infants, term infants, which are those born after 37 weeks, have lower risk of complications. In term infants, delayed umbilical cord clamping is associated with higher red blood cell levels at 1 to 2 days after birth and lower risk of iron deficiency at 3 to 6 months of age. However, delayed umbilical cord clamping in term infants may increase the risk of jaundice, which will require phototherapy or being under the Billy lights. If untreated, severe jaundice can result in complications. And although there is limited information about the long-term effects of delayed umbilical cord clamping in term infants, I will tell you, for me, I've seen more of the jaundice in the women who chose to do that in term infants. So the immediate benefit may not be there, and we don't know enough about the long-term benefit. So just make sure you talk to your delivering physician and even the pediatricians if you have time before delivery to just get their opinion on it as well. Because sometimes babies can be under the belly lights for a few days and even go home and still require repeat blood samples if they became jaundiced in their term. So those are things to consider when you're doing delayed umbilical cord clamping. So back to that question, if a woman has chosen to do delayed umbilical cord clamping, is that going to interfere with collecting the cord blood?
So it sort of depends on how long you choose to delay.
Yeah.
So obviously the longer we wait, the less blood is going to be left over for us to collect. Mm-hmm. So there have been a couple of studies published from several different public banks around the world that have collected data about how delayed cord clamping affects the collection volumes. And based on that data, what we have seen is that if you do a delay of about 30 to 60 seconds, we don't actually see a significant difference in volume or number of cells collected. If you think about just how long it takes to kind of clamp the cord, cut it, get the kit together, stick it in, like it's about 30, 60 seconds, depending on the situation. So we don't really see a huge difference then. If you delay beyond about a minute, especially if you go beyond 2 minutes, it's very unlikely there's going to be enough blood left to collect.
Right.
So we definitely encourage everybody to just kind of talk to your healthcare provider about the pros and cons, weigh the benefits, kind of talk about your goals and your priorities and figure out, you know, what really makes sense for you and your situation. Yeah. And then the other thing that's important to remember is that cord tissue collection is completely unaffected by delayed cord clamping. So even if you want to do a very long delay and there's no blood left to collect, you do still have the option to collect the cord tissue. Right.
So while we're talking about delayed cord clamping as well, I think there's a common thought that if we do the delayed cord clamping, that there's a continual flow of blood into the baby. But that's not necessarily true because nature still works and contracts, and the uterus's goal is to not get rid, it sounds awful, is to deliver a baby and then deliver a placenta. So even if you wait 5 minutes, there may not be any blood going back into the baby because the uterus may have already done its job and released the placenta. And if the one thing we have to also worry about as the obstetricians is if we are doing delayed cord clamping and waiting longer to deliver that placenta, there could be the instance where, and I've seen it, the woman's bleeding into her uterus and we don't know yet because the placenta I haven't delivered the placenta yet because she wanted delay cord clamping. So we have to be aware of that to make sure that that's not happening. And so I may cut it short because I'm worried, you know, I know there's indications that she might be bleeding. So that's another thing that we have to consider as well. So again, it's always better to talk to your provider about that, especially if you're wanting to do delayed cord clamping and cord blood banking, because you might have to decide if you want to do both to decrease the amount of time for delayed cord clamping in order to get a good specimen for the cord blood banking. So that would be my recommendation if you wanted to try to do both. Okay, so what else? Let's talk about COVID-19. I'm sorry, I can't let you get out here without talking about that. It's going to be on everybody's list of questions. Is COVID-19 going to impact a woman's ability to bank or do cord blood banking for a baby?
It is not. So we haven't had any interruptions in our services at the laboratory. The couriers have still been able to get to the hospitals and collect the samples, which I think was one of the biggest concerns at the beginning. So we haven't had any issues kind of getting the samples to the lab and processing them as we always have done. I think one of the questions that people are thinking about this is like, are the samples safe? Is there a chance for them to be like potentially contaminated by other samples coming in? But we've always had processes in place to keep the samples very safe and from cross-contamination. Yes, absolutely. We actually at CBR process everything within a closed system. So that just further helps to keep everything separated and reduce the risk of cross-contamination. I kind of like to remind people that there are other infectious diseases that we kind of always have to be thinking about, some of which are transmitted by blood, right? And that's what we're handling. So we always have had to be very careful with handling these samples and absolutely minimizing the risk for cross-contamination. So we always do that. We continue to do that. And from that perspective, the samples definitely are safe and can definitely be stored even with this going on.
So I would also add that if you happen to have COVID-19 at the time of delivery and you are positive and you're asymptomatic or mild symptoms or actually sick, it's important to talk to your team as well to see what their recommendations are, because we don't know yet about what it could be in the cord blood or not. We don't have enough information. I don't think that actually collecting the specimen would be an issue, but the whole thing surrounding COVID-19 at the time of delivery, I don't think we have enough information on that. So just make sure you talk to your healthcare provider if that's something that you're interested in doing and you end up being positive at the time of delivery. I wish I could tell you the right thing to do, but nobody knows.
Yeah, I think ACOG's recommendation right now is, it's not a contraindication to collect. You definitely can. From CBR's perspective, if you know you're positive, we would want to be notified of that just so we can put it in your record, because we are still learning more about this and we don't know what it might mean in the future. So it's an important thing for us to know about, but doesn't mean that you can't collect from our perspective.
Right. Yeah, just again, that's also especially another reason right now to let your doctor know ahead of time and that's your wishes so that they can be prepared for that. Because when someone's delivering and they're COVID-19 positive, there's less people in the room. There may not be as many hands to help facilitate collecting, so we have to prepare for that and make sure everybody still remembers that's what we're going to do. So it's important to just remind them so that we can still not miss that opportunity if that's something that you and your team is deciding to do. Okay, so the last thing I want to talk to you about is cord tissue, and we did do cord tissue for both of them as well. So you talked earlier about collecting a segment of cord in addition to the cord blood sample. So what is it the cord tissue used for?
Yeah, so the cord tissue actually contains a totally different type of stem cell than the cord blood contains. So the type of cell that we get from cord tissue is called a mesenchymal stem cell, or an MSC. And this particular type of stem cell, we talked about the stem cells in cord blood and how they're able to turn into blood and immune system cells, but not anything else. Well, the cells in the cord tissue, these MSCs, are able to turn into all of our connective tissue cells. So that means that they can become things like bone and muscle and cartilage and fat, any type of connective tissue cell, but they cannot become those blood or immune system cells. So they have different uses. They can't be used in the transplant situation to regenerate those blood and immune systems. But what we are seeing is that there's a lot of research going on using those particular type of stem cells from the cord tissue for lots of those research indications. So everything from there's, research looking at potentially treating diabetes with these cells, different types of autoimmune diseases like lupus or MS. There's even a trial going on right now using these cells for autism. And one that should start soon for cerebral palsy. So they're being investigated for a pretty wide range of conditions. And one of the reasons that they're so interesting is because there's a lot of evidence that this particular type of stem cell does a really good job at controlling the immune system and sort of reducing inflammation in the body. So some people might have seen in the news recently that this type of stem cell from cord tissue is being investigated to treat the lung disease actually associated with COVID-19. Yep, because of its ability to reduce inflammation, which is obviously a big problem with that particular lung disease. So there's a lot of great research going on with the cord tissue. We're, definitely seeing that more and more people are interested in banking the cord tissue because of its just huge potential in all of these different applications. But it is important to know that this is still all on a research basis for cord tissue. Right now, there aren't any FDA approved treatments yet.
Yeah. So I banked it. How long have you guys been doing cord blood tissue banking along with the cord blood?
We started cord tissue in 2010.
Yeah, so I didn't even know that was an option, and I should know. I didn't know it was an option until I delivered my twins, and I was like, well, heck yeah, I'll do it. And I was actually glad. Really glad, especially when my daughter didn't get as good of a sample as my son. So I was glad to have made that decision because again, I expected, of course, that I were going to have great samples, but I was delivered at 31 weeks due to abruption, And it happened very quickly. My son and daughter were born about 30 seconds apart, but thankfully my team did everything they could and were able to get, you know, a great sample for him and an okay sample for her, both well enough to be banked. So again, that it also shows you that you can still do it even in an urgent situation. And they were preemies and they were still able to do it. So I'm very grateful for that. And I think it's because of my preparation for them as well. I was like, please try, please try. So yeah. Okay. So I'm going to talk real quickly about the benefit you guys are giving us through CBR. So after this is over, I'm going to post a link in my stories where the Babies After 35 community will have, if you use that link in the stories and swipe up, you will get a $500 off on cord blood preservation and $1,200 off of cord blood plus tissue preservation. So the link is directly related, directly linked. I will also put in there a code that you could have just in case you somehow get off of the link, but you can use this code, especially if you're wanting to talk to, what were the people that help guide people to, what are they called?
Newborn stem cell educators.
Okay, so a newborn stem cell educator. So you get to know, hey, I have this code through Babies After 35. You can give them that code. It will also be in my bio on Instagram in my link tree. I'm going to put at the very top that link that goes directly to the discount. So please just check it out. You don't have to do it, but you can see what all the options are there. If you have more questions beyond what we discussed here, they will answer all those questions for you. I know I probably exchanged about 30 emails before I was really annoying them, but they were so nice. So I really do appreciate that. But that's it. Those are the questions I have for you. Was there anything else that you think that we should talk about that we did not get to, or we haven't mentioned yet?
I think maybe the only thing that I would add on to the cord tissue conversation is just to make sure, because it is kind of a newer thing that people know less about, that those cells actually do have a little more flexibility with who in the family can use them.
Okay.
So they don't actually require the same genetic matching. They're what we call immune privileged. They don't have the same kind of markers on the outside that we have to worry about matching. So more people in the family can potentially use those cells. So the way that we're regulated, really anybody out to a second degree relative would be able to use them, which would include grandparents of the baby, aunts, uncles, eventual nieces, nephews, children, grandchildren, right? So out to second degree relatives. And the other point about cord tissue, which is unique, is that those cells are actually very easily expandable in the laboratory. So when I think of cord blood, I typically think of it being 1, maybe 2 treatments, depending on the size of the person being used and how many cells we need. But it is a finite ratio. We can actually multiply those cells out many, many times over. And so we can get multiple treatments out of a cord tissue collection as well. So those are a few advantages of cord tissue that we didn't touch on that I think are important for people to know about.
So when you freeze and store these, I imagine they're being stored separately. So I have cord blood sample and a cord tissue. So they're probably frozen at different temperatures and all that. So they're going to be in 2 separate things, right?
They're frozen at the same temperature.
Oh,
so everything is kept at minus 196 Celsius. So very, very, very cold.
Cold, yeah.
But they're just in different systems for how they stack up in the containers. So they are in different cryo tanks, but they're stored at the same temperature and preserved in the same way.
Yeah, so you wouldn't, if you had to use your cord blood for something, that would mean you have to use your cord tissue as well. You could say
correct,
that,
correct. And if you're using your cord blood, it's stored in multiple compartments. You don't have to use all of the cord blood. It's just that for many treatments, they are going to require the whole thing, but it's stored so that you can separate it out. So and same thing with cord tissue.
So that would depend on the volume of the cord blood sample. So they divide it up according to the volume, I would guess, right?
Yeah, so we store it in it's a 2-compartment bag. So there's 80% of the cord blood in a big compartment and then 20% in the smaller. So if we don't need the whole sample, we can just release that 80% and keep the 20% frozen for the future, or vice versa, depending on what's needed.
Okay, sweet. I have no idea. Well, it makes sense. That's actually a good thing. Okay, well, I do appreciate your time today. I'm on vacation this week, and I was like, I'm going to knock out a bunch of live sessions. And I've been working with CBR all month because as soon as I knew it was Cord Blood Awareness Month, I'm like, I want to do this. And we finally got it arranged. So this live session will be on my Instagram TV indefinitely, and also in my feed, so you guys can watch this and share this. And you can also go to, what is your Instagram handle? At Cord Blood Registry, right?
Cord Blood Registry, yep.
So at Cord Blood Registry is the Instagram handle for CBR. And you can go to, it's cordblood.com is your website, correct?
Yes, correct.
Yeah. And then up in the right-hand corner is an 800 number. I was too lazy and distracted, I guess, being on bed rest. So I was like, I can't, I'm just going to call them. and work it out that way because it's much easier for me. So if you're like me, the number's there. If not, and you want to do your own research, there's plenty of information online. So thank you so much, Michelle. I appreciate you for doing this. I think it was great and a lot of good information, and hopefully we can continue to raise awareness.
Fantastic. Thank you so much for having me.
Okay. Have a great day.
You too.
Bye-bye.
Bye-bye.